Welcome, Dadas all over Kenya and East Africa. This is your show. We are always so delighted that you chose us on KBC Channel 1 on Sunday at 4 p.m. Asanteni Sana. Today we want to talk about wellness, health and wellness, and just living your best life. So I'm joined by Perpeture, Waithera. Perpeture, I remembered your two names. Perpeture had a beef. She made sure, she told me that she wanted me to remember her two names. So I'm joined by Perpeture Waithera. Perpeture is a specialist in health and wellness, and especially at the workplace. But let's start by talking about health and wellness. And before that, could you tell us a bit about yourself?
Okay, my name is Perpeture Waithera. I work for NOPE International Institute. And at NOPE, we provide health and social solutions for organizations. So we focus on health and wellness. And we even have programs that focus on health and wellness for women. So, and when we talk about health and wellness, we are talking about the mind, we're talking about the heart, and we're talking about the body. Health and wellness can be, caters for physical wellness, we have emotional wellness, we have mental wellness. So that's what we focus on at NOPE. And I'm a mental health specialist as well as a health and wellness expert.
So you're a mental health specialist?
Yes.
Okay, so where did you go to school? Is this something you always wanted to do, or did you land did you land here by some flukes?
Well, I think since I was young, I always knew that I wanted to work with people.
Okay.
And I wanted to do work that improves the lives of people.
Yeah.
And I actually did an undergraduate course in education. But then I knew I didn't want to do MBA. I wanted to do a master's in a course that actually deals with real people issues. So I did a master's in psychology. But my work experience took me to working in the area of health, specifically preventive health. And that is why we talk about wellness, health and wellness, because we are talking about prevention. The doctors treat. For us, we advocate for prevention. You prevent before, then you don't, if you prevent well, then you don't have to treat. Yeah.
Okay. Is there a particular reason you are in the area of women, or did you just land there by?
Well, I think that women have unique health needs.
Okay.
So I think all human beings have health needs,
Yeah.
but the needs of women are a little bit unique.
Okay.
When you talk about a woman at the workplace, she has needs like family planning. She has needs like having knowledge and being able to access maternal health services. A woman would be at work and she's wondering about her children. The women are the ones who take their kids to hospital. They're the ones who know what the kids are gonna eat. As much as the dad is also busy looking for the bread, they're going to eat but the mom is the one really who knows, who manages the home. So she's managing her work and she's also managing her home. So when it comes to issues to do with health and wellness, really the woman takes a focal point. And also because a woman really influences not only what happens at the workplace, but also what happens at home. So programs that focus on empowering women to be healthier and to have a better health-seeking behavior, and not only ensuring that employees are healthy, but it also ensures that their families are also healthy. Whatever the woman learns at work, she takes back home.
Yeah.
If a woman is healthy, that means she's a better employee, she's happier, and when she goes home, she's also, more productive at home, and she takes care of her husband and her children.
Okay.
Yeah.
What are you seeing a lot of these days in the when you, because I think for you the workplace is where you meet women, isn't it? That's where you interact with them. So when you meet them at work, what are some of the things that you're beginning to notice about women and health?
Okay, there are two aspects to health and wellness. There are issues that have always been there for women and also men. Issues like HIV. We've talked about HIV for decades now.
Yeah.
But it hasn't gone away. People are still
HIV is still a big thing?
Yes, people are still getting infected every day.
Okay.
And particularly people who are young, between 15 and 30.
Yeah.
People are still getting infected every day. So that is still a workplace discussion.
Yeah.
And then we also have issues like the ones I had talked about, family planning, maternal health. And then mental health now is a big deal. And it has been compounded by COVID-19. So because of the challenges of COVID-19, there are more people who are having mental health issues, stress-related issues. So that is a big thing in the area of wellness right now. And then, of course, COVID. And then the other thing that we were focusing on, especially immediately after HIV, was non-communicable diseases. So we have the cancers, we have hypertension, and we have diabetes. Apparently, non-communicable diseases are making more people sicker for longer, and more people are dying from non-communicable diseases compared to even HIV. HIV now is fairly well managed. People are on ARVs, so people are able to lead high quality lives, and people are not dying as much as before. But non-communicable diseases are a health issue, not only at the workplace, but also at the community.
Yeah.
So when we talk about health and wellness, we cannot leave out non-communicable diseases.
Okay.
And now, of course, COVID has come into, I mean, I think COVID is the one thing, COVID-19 is the one thing that we cannot leave out when we talk about health and wellness at the workplace. And particularly because it's preventable. And I also need to mention also, when it comes to health and wellness, there are preventable illnesses. There are those, most of the non-communicable diseases are preventable. You can prevent or delay the onset. Like, for example, I remember when we were growing up, it was very rare to hear of someone who has cancer.
Yes.
So, you know, people used to say in that village or in that town, they'd be like, so-and-so has cancer. And people would be like, what is cancer? Now, everyone knows several people who have had cancer. Same with diabetes. Diabetes, we used to say, it's for old people, it's for people who are rich. Yeah. Now, well, we have 30-year-olds, 40-year-olds, everyday people are getting diabetes. Younger people are getting hypertension, people in their 20s even. Same with cancer. So it's really a big discussion. And obviously, this is affecting workplaces. It's affecting employees. If employees are unwell, then they can go to work. It is also a cost for organizations. It drives the costs of the healthcare costs really high. So when you take the conversation of prevention and wellness and health to the workplaces, it is the best thing you can do, because employees spend a lot of time at the workplace. If you can be able to reach them with preventive messages, then you can prevent and delay the onset of communicable and non-communicable diseases.
Yeah, but Perpetua, isn't it true that for a long time women have not taken health seriously or wellness seriously? I think we've been busy. We've been very busy. I mean, to be honest, when you take a typical woman or a typical lady who starts work at maybe 24 and maybe gets married in her late 20s, starts having children, maybe has 1 or 2 children by the time maybe she's 35, is bringing up children until maybe she's in her early 40s or mid 40s, and has been working for maybe 2 decades, bringing up children, running a family, going back to school. It's busy. It's very hectic.
Yes, you're right. And it's hectic on 2 levels, based on what you've told me. When you look at a woman's schedule, she could be too busy even to have health-seeking behavior. She could be too busy to eat well, too busy to exercise, too busy to go for the annual checks. And of course that piles up. So one day she wakes up, she's in her 40s, and she has to deal with a health issue, and probably the doctor will tell her, oh, maybe
if you had come earlier.
Yes,
it's always the same thing. If you had, did you not notice this earlier?
Yes.
But having been a working mother for most of my life, I know it's hectic.
Yes.
There's no time for a breath. There's no time even to be ill. I mean, mothers have no time to be ill.
Yeah.
So what are you teaching women?
So when we go to the workplaces, we talk to them about several interesting topics. Number one, we talk about nutrition. Okay. Nutrition is a preventive aspect. Yeah. So if you can be able to have a balanced diet, a balanced meal. Ensure that your meal is balanced. That means that you're already giving yourself an advantage. You know, whatever non-communicable disease that you're predisposed to will most likely come much later as opposed to earlier. Yeah. So and we especially when we're training low-income women, there's a belief that if you don't have enough money, then you can't eat well. But we tell women really, actually, healthy food is quite affordable in Kenya. So like we give them this exercise where we tell them, assuming you have 200 to feed a family of 4 in a day, can you make your menu? And they go make their menu. And we look at it. So how was breakfast? How was lunch? How was supper? And some of them would realize, actually, like maybe we can decide to do githeri at lunch. A cup of githeri from the nearby kiosks, because we are talking about the busy woman, so she's not going to boil her githeri. Yeah. So it's 20 bob. So for a family of 4, you just need 4 cups, a few potatoes, an orange. That's already a balanced meal. That whole meal is probably 100 bob. Supper is the same, some ugali, some vegetables, an egg. That's already balanced and affordable. So those are some of the things that we teach women. So on nutrition.
You basically go down to the level of just teaching about food.
Yes, when we are talking about the issue of nutrition, and they do their own planning. Yeah. They say this is the amount of money we have, so we tell them plan with that money. Yeah. And then the other thing we talk about is family planning, because
why is family planning still being discussed?
Because women, it's not about telling women not to have kids. Yeah. It's about telling women, yes, you have your kids, but have them when you're ready. Yeah. If you want to space them out, yes, you have the opportunity to space them out. Because when a woman feels like she's not able to space out her children, when she feels like, even a woman, some women will feel like my kids are coming too fast. I'm not able to keep up. My body is not even having time to recover. So it's about telling women, have your children, but space them out, have them when you're ready, so that you're able to take care of each of them with the resources that you have. Okay. And maternal health. So family planning always comes with maternal health. So you're pregnant. So where can you go for help? Where can you go for clinic? Why is it important for you to go for clinic? So you've gotten your baby. How many times do you need to go to the clinic for you to continue being checked and your baby being checked and getting the relevant care? And giving this information to women has really helped them to be able to be healthier, and also for their kids to be healthier. It actually saves lives.
You know, Perpeture, I feel sad about this, because do you feel like you're filling a gap for some education that should have been given somewhere else? Because maybe by the time you catch up with me, I'm in my 30s, and I've already made so many mistakes. Do you ever feel frustrated?
Well, but my question is, where else would this education have been given? Maybe in school?
When you go to the workplace and you have to deal with things like basic nutrition, literally like budgeting, maternal health care, sexual reproductive health, family planning. Do you sometimes feel frustrated that it's a bit late in the day, that this education should have come in earlier?
Okay, it can be a bit frustrating, and especially when you meet a woman maybe who is mature and she had to struggle with maybe a non-communicable illness. Or family planning options, or even the challenges of not being able to access maternal health services. But at the same time, when you go to a workplace, you also meet younger women, and it's exciting to be able to mentor them and provide them with this information when they're still young, because then they're going to use that information for the rest of their lives. But at the same time, we also have 2 categories of women. We have the ones who have a little bit of more education. So for them, they have the medical cover, they have a few more resources, they can even afford to go for their annual checks out of their own budget. And then we have the low-income woman who probably got to class 7, maybe she got to class 4, maybe she got to Form 2, and she has been working most of her life. She's been doing low-income jobs. So that woman also is important in this conversation. And that's the woman that we want particularly to reach, because she may not really have access to the services that a more educated and more exposed woman might have. Like, for example, for you can walk into Aga Khan and get all the information you need, but there's a certain kind of woman who may not be able to walk into Aga Khan and get information, because she may actually even live very far from Aga Khan. She may not have the money to pay for the services. So that is also those are the women also we work with.
Okay.
And those are the women that we take this information to. And we link them to services. Like, for example, some of the organizations have a clinic. And some of those clinics offer those services there. So we encourage the woman. We tell the woman, if you see a lump in your breast, please go and discuss it with a nurse. If you see you're bleeding, you know, a bleeding that is abnormal, please go and discuss it. Because what happens on a typical situation, if a woman sees something different on her body, she'll probably go tell her friend, oh, I saw this thing. And the friend will say, yeah, don't worry. It will just, you know, it will resolve. 2 months later, the thing is still going on. Whatever it is growing or getting worse. Then she goes and tells maybe a relative, oh, she's told, don't worry, you just take this concoction. Go to my so-and-so, she'll give you a concoction and you'll be better. She helps so-and-so. So she takes the concoction, and 5 months later, the issue has not resolved itself. And if she's lucky, she will walk into a health center, and then she'll be told, why didn't you come last year? It's, the cancer imefika, stage 3 ama stage 4. So we take to them that information. If we see a mole, something different, go and discuss it. Sometimes women, there's one particular case I remember where the woman was having pain, and she had wounds in her reproductive area, and she thought it was cancer. So she was very scared, and she suffered for very many months because she thought, if it's cancer, I can't go to hospital. I don't want to die. I don't want to know about this thing. But when we took the education to them, she got the courage to go and see the nurse. And do you know, she was treated because it just happened to be an STI, a sexually transmitted infection. She was put on medication. Within a couple of weeks, she got her life back. The pain, the shame, the discomfort she had was resolved. So sometimes employees and women suffer because of a lack of knowledge, and that's what we are trying to take care of. Tell them, give them the information, and encourage them to get services. We know that they may not have a lot of money, but some of the services they can even get from their county health services. They can get from government facilities that are nearby. Like, I know if a woman wants to have a pap smear done, it's possible if you organize with the government facilities in that area.
Yeah, they'll come.
Yes,
I think before we go into a break, I wanted to ask, do you find that men seek information faster than women and they care for themselves more? I don't know. By the way, this is not proven. I'm just asking.
It's very interesting that you ask that. Because apparently, based on people who are in the public health domain, they know that women have better health-seeking behavior than men compared to men. Actually, we have a running joke where we say before a man goes to hospital, he has to first cough blood and faint before he says, oh, I think I need to go to hospital.
Oh, so it's actually the reverse.
Yeah.
It's actually the reverse. Men do not want to go to hospital.
Remember, a woman will talk about it. If you see something, you'll tell your friend. And your friend is likely to tell you, go to hospital, maybe, or she'll tell you something. A man may not talk about it, because also there's a culture thing, there's a cultural aspect of kukufa kimwanaume. It's just a cough. It will go nikahoma too, only to discover it's TB or, you know, cancer or something very serious. So men generally don't go to hospital because they are supposed to be strong. Homa itapita, you know, that dizziness itapita. But a woman will talk about it. So even when we go to the workplaces, we also have programs that help men to deal with their issues. The other issue that's unique to men also, I know today we're talking about women, but the other issue that's unique to men is mental health. Men don't talk about their issues. Women will gossip, they will, you know, they'll talk about it.
They'll cry, they'll go and cry with their friends, and then they'll go home and they'll feel better.
Yes, they'll sort of they'll get it out of the system. The men will not talk about it. So that is also another aspect. So that is a unique aspect about men's health. The mental health issue, and just encouraging them to notice the things that happen in their body and to seek help, to go for help. We like to talk about men because there are no women without men. Exactly.
So you know, we're going into a break. We'll be back we'll be back to talk about health and wellness for women and the workplace. Don't go too far. Welcome back, Dadas. We've been talking about health and wellness in this month where we are looking at International Women's Day theme, which is choose to challenge. So choose to challenge how you live. Are you living a lifestyle that allows you to be healthy and to be well? So I want to welcome back Francis. We've been talking with Perpeture, by the way. Welcome, Francis.
Thank you.
Karibu sana.
Asante.
We are at the Lamada Hotel, and there may be some sounds. It's an open, wonderful open place, sort of a patio, and there are monkeys, and we are one with the environment. So if you hear some sounds, don't be shocked. We're actually enjoying ourselves, or are we not, Francis?
Yeah.
First of all, please tell us a bit about yourself, so people don't assume.
As you have rightly called me,
Yes.
I am Francis Njangiru.
Mm-hmm.
I come from the background of counseling psychology and social work. And I do quite a bit of what Perpeture is doing at the workplace.
Mm-hmm.
Right now, I'm running a program called Workplace Women Health and Empowerment, which is a project for the United Nations Foundation, which is a US NGO that focuses on recommending to companies to strengthen their reach to women in the places where they work and in the communities where they come from. So we talk about reproductive health services, we talk about cancers, we talk about family planning, access to services and information, and we encourage partners like Perpetua and others to work with private sector companies so that they can empower women, especially to face the obstacles that they face, and therefore choose to challenge the obstacles that they meet.
Okay. First of all, I want to ask you, Perpetua just shared that according to statistics, men don't like to go to hospital. Is this true? When was the last time you were in hospital?
Every time a man faces a health issue, the first thing they do is to first of all say this thing will clear.
This thing will clear.
Yeah.
And maybe go to the pharmacies, the nearest pharmacies, and maybe buy a Panadol and maybe buy whatever so that the pain can subside. But it has a background. That culture has a background. A background of where, for a long time, the health services, the health systems have been focused on women because of maternal child health care, whatever. So it is women who go to the clinic to take children. It is women who go to clinic to be checked on their pregnancy.
It is women who have children, and that's
and because of that, that has that focus.
Okay.
But what men have not learned is that things are changing. That COVID is not only getting women, it is also getting men. That HIV does not only get women, it also gets men. And therefore, when you get a sore on your reproductive health organ, you don't ignore it. You need to go for it so that it is checked. And you know very well, Pauline, even where the community where you come from, you know very well that if a man is sick and in bed, everybody in that house is sick.
Completely.
Yes. Including the children,
everybody,
the wife.
and now they are all mobilized.
And even the dog of the house, of the home. Because the men, when they go and eat nyama choma there, they come with bones and throw it to the dog. When he's sick, he can't go to. So the dog will also know that this man is sick. And he's not going out.
So the men don't want to be sick.
They don't.
They really don't want to be sick.
Yeah.
I think by to introduce this subject about wellness and women and the workplace, which is, I think, what you're working on now.
Yeah.
Women are spending 40 to 60 hours a week at the workplace, and they are working very hard. And I think we discussed in the last time you were here that women are putting in, besides the work at you know, at the offices or wherever, they come home and put in more work. Some others have side hustles. So women are spending a lot of time at work.
Yeah.
And you know, some people have argued that until the second, the Industrial Revolution, after the Second World War, women were not so sick. Women, you know, when they stayed at home and cooked, they did better off.
Yeah.
So how much should we be investing in the wellness and health of women now?
I think any serious business should think about women's health, and because women, as you have rightly said, put about 40 hours a week at their workplaces. They go home, they do other things. When men are playing draft and ajua, women are also going to the shamba, cultivating. So it is important for companies to invest in women's health, because some of the companies where they are located, health facilities are very far.
Yeah.
Women don't have access to information. A woman will take maybe 2 or 3 hours to walk to the nearest dispensary, maybe from a coffee plantation. So if those services are brought closer to the woman, she will easily access the health services. If the information is brought to them, she will easily be able to know, when I have a lump on my breast, this could be cancer. When I have sores in the reproductive organ, this could be herpes or whatever that would also be because of that would cause HIV. And this information, women are educated by people like Perpeture at the workplace. Women are brought together and they spend about 1 or 2 hours getting that awareness, that information, that education, so that tomorrow if she faces a challenge, then she will know, oh, I heard Perpetua saying this and this when we were at the workplace. Last time when we were here with Kellen, she said she identified the lump in her breast because she had had it at the workplace, being educated by a person who had come in. So it is very important for them to do that.
She actually said that they choose to attend the
training.
The training, but also the cancer, you know, every
cancer
October.
Yes.
Every October you have these cancer screenings, and
Yeah.
should regularly go for the cancer screenings.
Yeah, so it is important for workplaces, for companies to invest in that,
Yeah.
to invest in education and to invest in access.
Yeah.
For example, if it is a cancer awareness week, bring people to screen them for cancer. If it is issues to do with family planning, help the women to access contraceptives, to access education, so that they can be able to make the right decisions. And by the way, if you listen to most of the women that Perpetua would meet, some of the family planning decisions are made by men.
Yeah.
They are made either by men or by their mother-in-law. The mother-in-law does not want her to space because she wants her to get as many children as she did, so that she can get grandchildren.
If you come from
quickly.
my community, the grandma, the woman is saying nizaliwe. So you
Yes.
have 4 boys.
Yes.
And she's saying, you know hamujaniza.
Yeah. But when this woman comes to the workplace and meets somebody who is talking about reproductive health and family planning, she will be told, this body is yours. You can make this decision about your body yourself. Nobody else, either your husband, your mother-in-law, or whoever, can make this decision about your body. And that makes sense to them, because then they feel more empowered.
Okay. Perpetua, who pays for these trainings? You know, normally, typically, I'm sure there are different ways, but typically, who is the one removing money for these things? So
there are 2 scenarios.
Yeah.
The ideal scenario is when the organization pays for their employees.
Okay.
So an organization says, these are my employees. I'd want them to be trained on health and wellness. Yeah. And in fact, some employers even go ahead and say, we have even set up a clinic. So they pay the nurse, they buy the commodities, so that employees can be able to access basic healthcare within the organization. The second setup is where the organization partners, or NOPE, the organization that I work for, partners with another organization that pays for the training. In some instances, we even have buyers. Like, for example, if an organization makes a certain product, the international buyers pay for that training because they want to support the people who work on that product. For example, if it's a flower farm, you have the buyer of the flower farm, the buyer of the flowers saying, we are paying this extra money so that the women who pick those flowers, or the men who pick those flowers, are healthier, so they can be able to access the services and the health information. So there are those two models. Either you go through partnership, or you get a donor to do it, or the organization pays for it. What we are recommending is that organizations pay for their employees to have this training. Why? Because if you're an organization and you have employees, your employees are the engine of that organization. I usually like to give this analogy. If you have machines, or maybe you're in the business of cars, transporting people, you always make sure that your cars are well serviced. They are in good condition. So if you have an organization where you have workers, you make sure that the employees are well taken care of and that they're healthy, that you prevent. And being healthy is about prevention and also treating. If you spend a little more on prevention, you'll spend less on treating the whatever illnesses that the employees might get.
Okay.
Yeah.
Francis, the typical employer, and you know, I don't want to name the bodies. There are bodies who come and say, we are already spending so much on electricity and what else, and fuel. We are laying off people. So forget about all this. Is fancy. This is, you guys are introducing fancy footwork here. We can barely afford to pay salaries. What would be your response to that?
My response would be for them to ask themselves, in all the inputs that they put in their business, which is the most critical? And they will tell you that the most critical input is HR. HR, human resource, is the most critical. And
probably the most expensive.
Yes.
When you look at people's wages, salaries, that's what probably takes up most of the...
But if you take care of your employees, the value is actually in cash. Let me give you an example. If this woman who is working in this company is not able to work properly that day, let's say it is an apparel company that is stitching jeans to sell to a goer. If she comes to the workplace and she's not properly working that day, she will stitch those jeans, but they will have a lot of product errors. So you will be forced to repeat that piece of work that she has done. You will be forced to pay for more material and to pay for more time to do that work. So that will cost you in terms of product errors. But if this woman came that day and said, I'm not feeling well, give me 2 hours to go to the clinic and get my treatment, she will come back and she will stitch that jean the way it is supposed to be stitched, and therefore you will have reduced your cost and your errors. So that is why we are insisting that it is important for you to take care of your employees. We know that public health is the work of government.
Yes.
But as government, we also need to support government to do this public work so that our bottom line can be protected and our bottom line can be enhanced. So we need to continue. We need to continue doing that. And we have done studies and we have seen that for every dollar that is used on health of a woman in the workplace, the company recoups $1 to $3 every year. And because of those product errors that we have talked to, absenteeism, issues of health, because if this lady is sick and it is a sickness that could have been prevented, then she will spend so much in treatment other than when we would have prevented it.
Okay.
Yeah.
There's now the issue of mental health, and I want to join it with gender-based violence. We live in interesting times, and I think I'll take up this from both of you. We live in very interesting times. I think the stresses of being alive have never been more serious than now. And I think people are becoming very violent by nature, and both women and men. And mentally, people are becoming extremely vulnerable. I think I'm noticing that the resilience of people to deal with issues is becoming less and less. What are you doing in that area, Perpetua?
Okay, on the area of mental health, number one, we are providing information. And one of the modules we have is called stress management.
Okay.
So the stress management module is about identifying what is it that is stressing us, and it becomes personal. So you ask yourself, what is stressing me? What is stressing me as Perpetua? What stresses me? And also being able to identify when I'm stressed, how do I react to this stress? And asking myself, how can I manage this stress in a healthy way? So it's about identifying healthy coping mechanisms for dealing with my stressors. Because you can deal with stress in unhealthy ways. Like, for example, you can decide to drink too much.
Yeah.
You can decide to be violent, like you said. You can decide to maybe give up hope. Some people commit suicide.
Become depressed.
Yes, or become depressed, just slip into depression. So those are unhealthy and harmful ways of coping with stress. So for us, we say, okay, so there are those methods, but are there other methods that are more helpful? And one of the ways that, and I'm very excited because the counseling is just coming up, people are beginning to accept counseling. So you can seek professional help, you can talk to a trusted friend, you can address that stressor directly. Like if it's money worries, you ask yourself, what can I do? What skills can I have to manage my money better? Even communication skills, emotional intelligence, how to relate to the people around you. Relationships also are a source of stress for a lot of people. And particularly now with COVID-19, the restrictions, the job losses, the uncertainties, loss, and grief. So we are looking at all those areas and helping people to know how to address them at their individual level. The area of mental health is very personal. You can't say this is a blanket. It can't be a blanket solution for everyone. Everyone has their own particular stresses, and everyone has their own coping mechanisms and their own options.
So for you, it's basically that you must learn how to manage your stress.
Yeah, sometimes people get stressed and they are not aware they are stressed. So even helping people to know, okay, by the way, I think now
I'm not okay.
Yes, I'm reaching my limits.
And for companies, we have over the years, we have encouraged them to train peer champions in the workplace. Champions who will be able to be trained, for example, by Perpetua's organization or by other individuals, to be able to know, when I see Pauline behaving this way, I think this is something to do with mental issues. So they approach them in a psychosocial way.
So you train people who can identify
the first aiders, who can identify that this is somebody who has this issue. They need first aid. They provide first aid. We are also encouraging companies, and I know most companies have done this, that get an external psychological support, a counselor who will come in and support your workers with counseling. So this staff has passed the first aid that was provided by the peer educator. The peer educator has said, wacha tupatiene kwa counselor. So the counselor comes in and does that. But what I would want to encourage HR managers who negotiate insurance issues, negotiate an insurance package for your staff that has inbuilt counseling services, so that the insuring company will be able to get counselors who will be able to be available for your clients. So within your medical cover, try to negotiate an inbuilt counseling services so that you are not paying medical cover and then you have to pay for counseling services. And I know insurance companies are getting into that, and they're accepting to have that inbuilt in the companies.
I'm told we've run out of time. I don't know how this happens every time. That's when we are getting into it, we run out of time. Thank you so much. You guys have been really you've really empowered us with information, which is critical. As I said, we women have gotten into the workplace, na kazi itafanywa. So we must prepare to work and prepare to work well. So Dadas, we've come to the end of this show. Thank you very much for watching. As always, we encourage you to have a great week. Be healthy, keep healthy, and be well. Baraka.